speaking of, Chicago has opened the door to get the coronavirus vaccine to a vast majority of city residents now. Eligibility is also looser elsewhere throughout the state, but the COVID case numbers you just heard are rising at a pace that has officials at all levels of government concerned. Amanda Vinicky joins us now. Amanda, how much of a concern?
Well, Paris, just weeks ago, Chicago was seeing COVID cases decline. You were seeing about 200 or so people test positive for COVID daily, and then the positivity rate, well, hovering around 2%. Now, about 400 people a day with COVID, and that positivity rate has doubled.
Yeah, so we're certainly seeing a rise in cases. It's not to the point that we were seeing in November, but it's something that we want to closely follow. We're very concerned about what the outlook may be over the next 4 to 8 weeks.
The mayor says that increase in cases is attributable to spread among 18 to 39-year-olds and also coming from the north and northwest sides of the city.
In our Lincoln Park, Old Town, Dunning, and Portage Park neighborhoods. We've also seen a number of outbreaks involving younger people among sports teams and as a result of bar crawls. And let me be clear, it's not the playing of the sports or being at bars that is causing these outbreaks. It's the risky behavior in those settings that's creating the problem.
Now, the alarm isn't just in Chicago. Per Governor J.B. Pritzker's reopening guidelines, the state can loosen restrictions. Some get to a bridge phase once 70% of seniors have been vaccinated. Now, it's not, by the way, a full reopening and life back to normal, but it will be a bit more relaxed. Conventions and sizable outdoor gatherings will be allowed then. Illinois is on the verge of that, with 69% of those age 65 and older having been vaccinated statewide. But the Illinois Department of Public Health announced today that other crucial thresholds will hold back this bridge phase, and it's unclear for how long. That is up to people wearing masks, taking other precautions, keeping COVID cases down. IDPH today sending notice that because COVID hospitalization metrics continue to trend upward, the state has not yet met the conditions to move to the bridge phase. It comes, as you noted, as more people are eligible for the vaccine. In fact, 84%, so the vast majority of Chicago residents now eligible. As of today in the city, all essential workers can sign up to get a COVID shot.
Now, all essential workers, many of whom are union workers, and including restaurant employees, clergy members, construction workers, delivery drivers, and warehouse workers, whose hard work has ensured our city continues to endure despite the challenges of the pandemic, can get protected with the vaccine.
Also eligible now, those under age 65 who have certain medical conditions. You can find a full list on our website, but it includes conditions like cancer, heart problems, and pregnancy, also those with disabilities. Anybody who was eligible under prior phases, so healthcare workers, frontline essential workers, and seniors remain so. But that doesn't mean that it's going to be easy as pie to get a COVID vaccine appointment. They still may be hard to come by. And the city is saying that most residents should expect to get a shot come April or May. Chicago clamping down on that too.
As vaccine supplies increase, everyone who wants a vaccine will get one. Additionally, beginning today, to ensure Chicago residents can better access vaccine appointments in our city, City of Chicago-run vaccination sites will only schedule appointments for Chicago residents.
Now, Chicago is a town where unions hold a whole lot of sway, and that is on display with the city's latest new mass vac site.
Here in Chicago and Cook County, I want to welcome you all to the first in-nation vaccination center run by the labor movement for union workers.
While only card-carrying members of labor unions can access and use this site, which is near Chinatown. Eligibility is also expanding throughout Illinois. On Friday, the Pritzker administration announced that in some areas of the state, there has been a reduction in demand for the vaccine, so much so that those places are free to begin vaccinating all residents, anybody 16 or older, at the local health department's immediate discretion in order for the vaccine doses that they currently have to be used. The state says that in the future, it is going to work to divert future additional allocations of the COVID vaccine to places like perhaps Chicago, where demand is far outpacing supply. But when asked about that today, Mayor Lightfoot didn't have any concrete word on the city receiving any additional doses from the state or elsewhere throughout Illinois. She also indicated that with the rise in cases, she is not planning a total shutdown.
If you think about where we were a year ago and where we are now, we've learned a tremendous amount about this virus. Still a lot that we don't know, but we also know that we can do things in a more targeted way and not have to shut down the entire economy and our way of life.
The mayor today also asked about the scandal with vaccines at Loretto Hospital. She says it is not her place to say whether CEO George Miller should be terminated, but she says it is in the city's interest that Loretto Hospital continues to serve residents on the west side. She says, however, this drip, drip, drip of negative stories of vaccines going to places they shouldn't and to individuals with privilege as opposed to those who reside on the west side. She says that that is really hurting credibility at a time when the healthcare system needs people to believe in it more than ever so that people get that vaccine and this pandemic can end. Paris, back to you.